Welcome back. The British government offered a sincere apology today to those who suffered at the hands of one hospital in central England, but the family of the victims want heads to roll. In a damning report highlighting deplorable acts of mistreatment and neglect, the Stafford Hospital is also accused of causing over 1,000 deaths. 1,200 deaths and a damning report filled with hundreds of failings are what victims' families describe as the unpunished crimes of Stafford Hospital between 2005 and 2009. A hard fact to swallow, and in this case, the truth hurts.
There was a lack of care, compassion, humanity, and leadership. The most basic standards of care were not observed, and fundamental rights to dignity were not respected. Elderly and vulnerable patients were left unwashed, unfed, and without fluids. They were deprived of dignity and respect.
One such patient was the husband of Sue Williams Ashford, who underwent a routine surgery to remove a tumor.
It was meant to be on hourly observations, but it turned out when we had his medical records to hand that he hadn't been seen from about 9 o'clock in the evening until 5 to 4 when he was found dead.
For that death and the hundreds of others who needlessly died, along with 1,782 pages worth of catastrophic failings at every level, an apology from the hospital was expressed.
We are terribly sorry to all those people and their families who suffered as a result of poor care here. There was a problem, huge amount of work, led by clinicians, doctors, nurses, supported by managers, has turned this place round.
But apology not accepted, say the families of those wronged. They demand the resignation of the managers who failed to stop the scandal. That includes the head of the National Health Service and the chief executive of the Royal College of Nursing. With wider systemic failings leveled against the hospital, Britain's Prime Minister took the apology one step further.
So I'd like to go further as Prime Minister and apologise to the families of all those who suffered for the way that the system allowed this horrific abuse to go unchecked and unchallenged for so long.
Today's shocking report triggered the investigation of 5 more NHS Foundation Trust hospitals that have persistently high death rates.